We go now to our other big story, a big spike in the numbers of coronavirus cases in Michigan. Over the past 3 days, there have been nearly 4,000 new infections. That's about 1,320 new cases a day. There were also 3 additional deaths in the state. That's nearly double the cases from Tuesday and significantly higher than the number of infections we had this same time last year when Michigan was averaging 722 cases a day. We're going to begin with our chief health editor, Dr. Partha Nandi, standing by now. And Dr. Nandi, do you expect these numbers to rise in the days ahead?
First of all, Glenn, this is such disappointing news. When I found out about this, it just my heart sank. And unfortunately, I think that we'll see our case numbers continue to rise in the coming weeks. The Delta variant, it's exceptionally good at finding communities with low vaccination rates, and we have some of them. And so far, only 63.9% of Michiganders aged 16 and up have received at least 1 dose of the vaccine, and only 49% of all ages are fully vaccinated. So I'm super concerned, especially with the new school year coming, and then you have many unvaccinated kids that are returning to class.
Well, Dr. Nandi, hospitals seeing dramatic increases in COVID-19 cases among children, and you were mentioning going back to school. So does this mean that this highly transmissible Delta variant is more dangerous for our children?
As a parent of young children and as a physician, it's super worrying for me to see the dramatic increases in pediatric cases of COVID-19. In one hospital, Glenda, in New Orleans, has reported 20 children with severe cases of COVID-19 in just the last 2 weeks. In the state of Florida, where the Delta variant is really raging, they've been averaging, get this, 35 pediatric cases a day. In one instance, in the city of Houston, the pediatric hospitals are so full, Glenna, that one baby girl was having seizures and needed intubation, and they had to be airlifted to another hospital 150 miles away. It is heartbreaking to hear these stories, but does this mean, people say, that the Delta variant is more dangerous for children, or is it actually causing more severe symptoms? Unfortunately, we don't know that. The answer isn't clear. The CDC is still looking at research to try and find out the answer. But what complicates this data is that last summer, right, we had pandemic precautions in place. So things like masking and social distancing, that's been relaxed this summer. So the reason why more kids are getting sick could be a combination of fewer strategies, right? Like that, like less masking and less distancing, and low vaccination rates, and a hyper transmissible variant. We don't know. It simply could be that more kids are getting more severe disease, and then that's because they're getting more infected. So having said that, really too early to know, and we need to collect more data about the Delta variant in kids.
And that's so frightening to talk about our kids, Dr. Nandi. We're on the cusp of flu season, but COVID can be much worse than the flu for children, correct?
Absolutely.
Okay.
So the flu, influenza, and COVID, they can share many similar symptoms, right? And they can both lead to death. But COVID-19 can lead to something called a multi-system inflammatory syndrome in kids. So it's a serious condition that they can cause dangerous inflammation in parts of the body. And we've talked about this, like the heart, the lungs, the kidney, brain, or the GI organs. It can show up weeks, Glenda, after a child has been infected with the coronavirus. And many parents are caught by surprise, right? Not knowing that their children even had the coronavirus in the first place, because they may or may not have had symptoms. And suddenly their child is seriously sick and is in the ICU with organ failure. Pretty frightening. Whereas the flu, usually you know what the symptoms are, and the parents, the doctors can address this and treat it, and treatment can get started quickly. So again, I'm stressing again the importance of vaccinations. The way to get through this is to get people vaccinated. So anybody over the age of 12, if you can get vaccinated against COVID, please do. We can help our younger kids, right? Younger ones stay safe if we surround them with a community that has a high vaccination rate. That's what's going to get us through. We'll keep an eye on the numbers, but again, I'm singing the same song again and again, right? Which is, please get vaccinated. That's what we get the numbers. That's how we're going to get through this, by protecting our communities and ourselves.
That has been your passionate message, Dr. Nandi. We appreciate you joining us this Friday afternoon with the update.
Thank you.